The research was labeled revolutionary, a radical treatment for multiple sclerosis. Last year, an Italian doctor claimed MS could be cured by a relatively simple operation. Today, MS patients right here in the GTA had a chance to ask health officials why that operation isn't available in Canada. Genevieve Tomney is live with the answer. Jen?
Yes, well, the answer is not until Canadian officials can validate that this treatment is safe and effective, and that led to the next question: what are Canadian researchers doing to prove that? Provocative questions from the crowd and the web. People living with multiple sclerosis wondering about a controversial procedure they hope could improve their lives.
I was in the hospital moving nothing from my neck down for 11 weeks. I had a 1-year-old son who I couldn't hug.
Today is a good day for Karen Tori Racine. She was diagnosed in 1985 when she was 23. Some days walking is impossible. So when Dr. Paolo Zamboni started making headlines for his MS research last year, she noticed.
So this really appeared to be easier to understand. So that's what was very exciting.
Zamboni's theory is that people with MS have blockages in the veins of their necks. His claim: many of their symptoms can be reversed with a simple surgery. People suffering from MS scrambled for the experimental treatment, including several Canadians who've spent tens of thousands of dollars to travel to Europe and have it done. Duncan Thornton has come back reporting success, but doctors at home remain wary. They say there have been no long-term trials, and the procedure itself has had some disturbing results.
We know that one clinic that started to do this procedure has stopped because one patient had the stent that was put into the vein go into their heart, and another patient shortly after died of a cerebral hemorrhage.
So the advice from Canadian officials is still to wait. The MS community here is hopeful that with more study, Zamboni's research could turn into something groundbreaking. But for now, it's just too early and too risky to say.
For people who are seeking experimental treatments, it's important to do so in the context of a clinical trial.
But it could be years before a clinical trial gets off the ground in Canada. In the meantime, the MS Society is handing out hundreds of thousands of dollars in research grants to try and bring this experimental treatment perhaps a little closer to reality. Reporting live downtown, I'm Genevieve Tomney.
Okay, Jen, thank you.